Hello students, we are going to explain how to perform analysis of abnormal constituents of urine. For analysis of any body fluid like normal, abnormal constituents of urine, milk and CSF, the practical should be divided into two parts. First is the physical examination and second is the chemical examination. Before going to start physical examination, how to collect a sample and what are the preservatives used for the urine. Collection of the sample, there are three types: fresh sample, 24-hour urine sample and random sample. For the fresh sample collection, morning sample is preferred one. Amount is required 10 to 20 ml and used for the routine investigation. For 24-hour urine sample, ask the patient to collect a sample from 7 am to next day 7 am. The volume is measured, mixed and small amount is sent for the examination. 24-hour urine sample is required for the protein estimation, clearance measurement and specific gravity measurement. And last one is the random sample. This sample is taken any time during the daytime and uses for the sugar and ketone body estimation. 24-hour urine collection, preservatives which are used are thymol, formalin and HCl. Thymol is required 0.1 mg for 100 ml of urine sample, formalin is 40% required and HCl is 5 drops per 100 ml of urine sample. For practical part, physical examination and chemical examination. Physical examination include appearance, color, volume, specific gravity, pH and odor. And chemical examination include test for protein, test for reducing sugar, test for ketone bodies, test for bile salts, test for blood, test for bile pigments and test for urobilinogens. This is the protocol how to write a physical examination of pathological urine. Volume, appearance, color, odor, pH, specific gravity and calibrated specific gravity. Volume written as per given to you, appearance, color. Now going to start individual parameter of physical examinations. First indicator is appearance. Normally fresh sample of urine is clear, colorless, without any turbidity. If the patient sample is turbid, then it is maybe due to the presence of pus cells and presence of fat globules. Pus cells present in urinary tract infections and fat globules are present in chyluria and lipiduria. Second indicator is color. Normally fresh urine sample is colorless. Different type of the color is present in different disease condition. For example, deep yellow color is due to presence of bile pigment in jaundice, reddish color due to the red color in urinary stone, cancer, urinary schistosomiasis and trauma. Brownish color of urine is due to black water fever, myoglobinuria and porphyria. Brown to black color of the urine is in alkaptonuria. Fresh urine sample is normal. On standing position, it convert to brown color. Dark amber color urine is found in concentrated urine or vitamin B complex therapy. Pale urine is found in diluted urine in diabetes insipidus or polyuria patient. Orange color is due to certain drugs like rifampicin and riboflavin. Now for the third indicator is volume. Normal urine output is 1 to 2 liter per day. The conditions are polyuria, oliguria and anuria. What is the definition of polyuria? When the urine output is more than 2500 ml per day, it is known as a polyuria. It is seen in the diabetes mellitus and diabetes insipidus. Oliguria is when the urine output is less than 500 ml per day. It is considered as a oliguria. The conditions are severe dehydration, acute renal failure, reduced circulatory volume like edema and fever, fluid loss in vomiting and diarrhea. And last one is anuria. When the urine output is less than 100 ml per day, it is considered as a anuria. The conditions are acute tubular necrosis, post-blood transfusion reaction and post-surgical shock. Next indicator is a specific gravity. Specific gravity is directly proportional to the solutes present in the urine and inversely proportional to the volume of urine. Normal urine have a specific gravity 1.010 to 1.024. The specific gravity increased, decreased, or it is a fixed. In which condition specific gravity is increased? The conditions like diabetes mellitus due to presence of glucose, severe dehydration, and nephrotic syndrome due to presence of protein. In this condition, specific gravity of urine is increased. Diabetes insipidus. In this condition, specific gravity of urine is decreased due to presence of overloaded volume. And fixed specific gravity is seen 1.010 in chronic renal failure patient. In our practical, specific gravity at 15 degree temperature is 1.030 and room temperature of our is 30 degree. So we have to calculate the corrected specific gravity. How to correct the specific gravity? Urinometer is standardized at 15 degree temperature. Every 3 degree rise or fall in temperature, we have to add or deduct 0.001 from the original reading respectively. In case of proteinuria, true specific gravity can be determined by deduction of 0.003 from the observed value for every gram of albumin present per 100 ml of urine. For example, specific gravity at 15 degrees is 1.030 and room temperature is 30. So how do we correct the calibrated specific gravity? For the corrected specific gravity, we have to calculate specific gravity at 15 degree plus point observed temperature minus 15 upon 3. So observed temperature is 30 minus 15 upon 3 is 0.005. So corrected specific gravity is 1.035. Now next indicator is pH. Normal pH of urine is 4.8 to 6, means it is slightly acidic. The acidic urine is normally seen in the high protein diet. pH of urine is decreased in acidosis, diabetes mellitus, starvation, and diarrhea. And increased pH means alkaline urine is seen in the severe vomiting condition and urinary tract infection. Next indicator is odor. Normally, normal urine is aromatic odor due to the presence of volatile organic acids. The foul smelling of the urine is due to bacterial infection. Mousy smell of the urine is due to phenylketonuria, and smell of acetone or fruity odor is seen in the diabetic ketoacidosis and starvation. Now, second part of analysis of abnormal constituents of urine is biochemical examination. In biochemical examinations, which we are going to perform tests for protein, reducing sugar, ketone bodies, bile salts, bile pigments, blood, and urobilinogen. First part is test for proteins. Presence of protein in the urine is usually pathological and it is known as proteinuria. Most commonly protein found in the urine is albumin. In normal adult, total urinary protein excretion is less than 150 mg per day and albumin excretion is less than 30 mg per day. Tests for the proteins are heat coagulation test and sulfosalicylic acid test. Both the tests are performed previously in the qualitative estimations of protein. How to perform this test will be explained in the next video. Now, what are the causes of proteinuria? Pre-renal, renal, and post-renal causes. Pre-renal causes are mostly due to overloaded proteinuria, in which non-albumin proteins are present. Causes are multiple myeloma, in which light chains of immunoglobulins are excreted, severe hemolysis, and severe muscle injury. Renal causes are glomerular disease or tubular disease. Glomerular disease include diabetes mellitus and hypertension, and tubular disease include tubular necrosis due to drugs. Post-renal causes include various blood and cellular proteins excreted in the urine. Causes are bleeding in urinary tract, infection in urinary tract, and tumor present in the urinary tract. Other causes, most commonly physiological causes of proteinurias, are postural. On long standing position, the proteins is excreted in the urine. Other causes are severe exercise, exposure to cold, physical activity and fever, and last week of pregnancy are the physiological causes of proteinuria. Nephrotic syndrome is the commonest cause of proteinuria, where the protein excretion is more than 3.5 gram per day. Microalbuminuria is the excretion of albumin 30 to 300 milligram per day is called microalbuminuria. It appears to be a predictor of the future development of clinical renal disease in patients with hypertension and diabetes mellitus. Now, second test is for reducing sugars. Reducing sugars like glucose, fructose, galactose, lactose and pentose may be present in the urine in some pathological condition. Test for reducing sugar is Benedict test, which is previously performed in the qualitative estimation. Now, what are the clinical findings if reducing sugars are present in the urine? Glucose. It is known as glucosuria, most commonly seen in the patient of diabetes mellitus and renal glucosuria. Renal glucosuria is a condition in which renal threshold for the glucose which is decreased to 150 milligram percentage. So glucose appears in the urine at this level. Lactosuria, lactating mother and last trimester of the pregnancy. Fructosuria, essential fructosuria or hereditary fructose intolerance. Galactosuria is seen in the patient with the galactosemia in children. Pentosuria, sometimes high intake of fruit like cherry, plum due to deficiency of xylitol dehydrogenase enzyme. Some non-sugar reducing substances like creatinine, ascorbic acid, urates, glucuronides, drugs like salicylate, isoniazides may give false positive result. Now test for ketone bodies. What are the example of ketone bodies? Acetone, acetoacetate and beta hydroxybutirates are collectively known as ketone bodies. Tests for ketone bodies are new for you. Two tests are available, Rothras tests and Gerhardt test. We are only performing one test, Rothras test. Procedure for the Rothras test is 3 ml urine plus you have to add 3 ml saturated ammonium sulfate, 2 to 3 drops of sodium nitroprusides and add 0.5 ml of concentrated ammonia. Observe the color changes. Permanganate color is observed. The procedure how to perform the Rothras test will explain in the next video. Both these tests only positive by acetoacetate and acetone but not for beta hydroxybutyrate due to lack of ketone group. Now, what are the indication in which condition ketone bodies are present in the urine? It is present in severe uncontrolled diabetes mellitus, means in patient of diabetic ketoacidosis, in starvation, toxemia of pregnancy, and intake of high fat and low carbohydrate diet. Next is test for bile salts. What are the importance of bile salts in the urine? This test is in the urine is performed to assess the liver function. Bile salts are the sodium and potassium salts of glycocholic and taurocholic acid formed in the liver from the cholesterol. They are secreted in the bile and they reduce the surface tension and aid in the digestion and absorption of fat in the intestine. Test for bile salt is Hayes sulfur flower test and Patten-Koffer test. First is the Hayes sulfur flower test. Procedure for the Hayes sulfur flower test. Take 3 ml of urine sample in one test tube. Add a pinch of sulfur powder on the surface of urine. Don't shake the test tube and put a control with the water in place of urine for the comparison of the test. Sulfur flower sink to the bottom of the test tube indicates bile salts present in the urine. What is the principle of Hayes sulfur flower test? Sulfur powder is a non-polar. It floats on the water surface due to surface tension of water. Bile salt reduces the surface tension of water and thereby sulfur powder sinks to the bottom of test tube. Second test is Patten-Koffer test. Procedure is 2 ml urine, then add 2 to 3 drops of sucrose solution, then add 2 ml of concentrated H2SO4 along the wall of the test tube. Observation is Violet color ring observed at the junction of two layers indicates bile salt present in the urine sample. Principle is bile salt condensed with the furfural to give a purple color junction. These are the tests only you have to remember for the viva purposes. Test for blood, test for bile pigment and test for urobilinogen. First is test of the blood is benzidine test. Test for the bile pigments, which include test for the bilirubin and biliverdin. Presence of bilirubin in the urine means excretion of conjugated bilirubin, usually seen in the hepatic and obstructive jaundice. Now test for the bilirubins, you have to just remember the name of the test are Fauche's test and Mellin test. Now what is the importance of urobilinogen and test for urobilinogen? Urobilinogen is a colorless compound derived by the bacterial oxidation of bilirubin in intestine, which is reabsorbed by enterohepatic circulation and excreted in urine. In normal person, very little amount of urobilinogen is excreted in the urine, which is less than 4 mg per day. Its urinary excretion is increased in hemolytic and hepatic jaundice, but it is completely absent in obstructive jaundice. Test for the urobilinogen is named as a Ehrlich test. Pinkish red color indicate presence of urobilinogen, and this examination is useful to differentiating various type of the jaundice. This is the chart which is useful for the differential diagnosis of the jaundice: hemolytic, hepatic and obstructive or the post-hepatic jaundice. Bilirubin is absent in hemolytic jaundice, present in hepatic and obstructive jaundice. Bile salt in the urine is present in hepatic and obstructive jaundice and it is absent in hemolytic jaundice. Urobilinogen is present in hemolytic jaundice and absent in hepatic and obstructive jaundice. Now going to writing part for the analysis of abnormal constituents of urine practical. First we have to write down the physical examination, then you have to write for the biochemical examination. In physical examination, volume which is given to you in your practical examination, appearance is turbid or not, color is yellow, odor is fruity, pH is acidic. You have to do a litmus test when it is turned blue to red or red to blue. Specific gravity at 30 degree is given to you and you have to measure corrected specific gravity by this calculation. Specific gravity is 15 degree plus point observed temperature minus 15 upon 3. 15 is taken because urinometer is calibrated at 15 degree. These are the table. This is the table for biochemical examination. Test for protein, test for reducing sugar, test for ketone body and test for bile salts. You have to perform only this much test for the abnormal constituents. After performing the test, you have to write down the conclusion. The given sample of the urine contains following abnormal constituents. Which are the test positive? You have to write that only parameters: protein or reducing sugar or bile salt and ketone bodies. In your practical examination, any two abnormal constituents are present at a time, so you have to be very careful for that. Chemical examinations of abnormal constituents of urine. First we going to perform test for reducing sugar, means Benedict test. For the Benedict test, procedure is take 5 ml of Benedict reagent, add 8 drop of the solution, mix it and heat and boil for 2 minutes and allow to cool for the observation. You have to be more careful while heating the test tube. Solution may be bump out. Heat it for 2 minutes and allow to cool for the observation. Green color is observed, so reducing sugar is present. Now next test for the protein sulfosalicylic acid test. Procedure is 3 ml urine plus add sulfosalicylic acid drop by drop. White turbidity is observed, so protein is present. For the comparison, first one is a normal sample urine and with the test tube holder is a test for sulfosalicylic acid. Turbidity is seen. Second test for the protein is heat coagulation test. Fill the 3/4 of test tube with the urine sample or the protein solution. Heat the upper portion of the test tube. Lower portion is act as a control for the comparison. Be careful while you are hitting the upper portion. The solution may be bump out. After heating, add few drops of 2 to 3 drops of acetic acid. White turbidity is seen in the upper portion which is heated and lower portion is clear which act as a control. So it indicates that heat coagulable proteins are present. Next test is test for the test for ketone bodies, Rothras test. For the procedure, 3 ml of urine sample plus 3 ml saturated ammonium sulfate two to 3 drops of sodium nitroprusside, mix it, add 0.5 ml of concentrated ammonia. Permanganate color is observed, means ketone bodies are present. Now test for bile salts, Hayes sulfur flower test. Take 3 ml of urine, add pinch of sulfur powder. Add a pinch of sulfur powder to that sample. Observe that sulfur flower sink to the bottom or not. You have to take a control test tube from the water. Take a 3 ml of water, then add pinch of sulfur powder to the water solution and observe. In the urine sample, sulfur powder sinks to the bottom, and in water, which is a control test tube, the sulfur powder floats. So it indicates that bile salt is present. Second test for the bile salt is Patten-Koffer test. Procedure: 2 ml urine, add 2 to 3 drops of sucrose solution, mix it, add 2 ml of concentrated H2SO4 along the wall of the test tube. A violet color ring is formed at the junction of two layers. It indicates that bile salt is present.